Okay, so we are going to go through chapter 21, which is measuring vital signs. And I'm pretty sure this is what we're doing in lab next week, so we will be discussing this again. So 5 vital signs: temperature, pulse, respiration, blood pressure, and pain. Pain is the 5th vital sign. It's referred to it that way because they used to not ever consider pain as being a vital sign. So it used to always be 4 vital signs. And then, I don't know how long ago, but it's not been too long ago they started calling pain the 5th vital sign. Vital signs are basically, it kind of gives us an idea of what the health status is of the patient. Different values, they may change depending upon age. We're going to focus on adult. Heat, you take somebody's temperature. What changes someone's temperature? Yes, we all know infection, but why? How? So it's basically the heat is due to your metabolism. Some people have really fast metabolism, some people have a slow metabolism. As metabolism increases, so does heat. So that is, people that do say, oh, I can just eat whatever I want and I just keep losing weight, or I don't gain weight. Their usually temperature is a little bit higher than those that have slower metabolism, like me, who barely eats and can't lose weight. My temperature is pretty low. My body temperature is normally like around 97. So if a body is invaded by a pathogen, now a pathogen is a bacteria, could be a virus, could be a worm, could be a fungus, any kind of pathogen, anything that's in the body that shouldn't be, is the body will recognize it as such, as an invader, and the body will raise the temperature and elevates what's called the basal metabolic rate, the BMR, because the goal is to try to destroy the pathogen, to kill the pathogen. I'm a big believer of this. If I get sick, I will do just about everything in my power to not take any kind of medication like Tylenol or ibuprofen, because I always just want my fever. It's like that's part of my immune system, is my fever kicking in to kill the pathogen. So I let my body do what it's supposed to do. Unless my temperature gets really high, like 103, then I'll take something. But other than that, I'm just like, all right, let's do this. Just have a fever and let's kill this bug that's invading me. Your BMR is affected by your thyroid hormone. Thyroid, remember we were feeling that in our neck. It's a butterfly-shaped gland in your neck. You can see a picture of it here. So when you have increased thyroid hormone, that's increased in your metabolism, your metabolic rate, and your temperature is going to be higher. And lower levels of thyroid hormone decreases the metabolic rate and a decreased body temperature. That's why some of the signs of hyperthyroidism, people are always hot, or hypothyroidism, that's the underactive thyroid, people, they're cold. They're usually cold. Some other things that affect the metabolic rate, things like epinephrine, norepinephrine, and testosterone. That's why men have a higher BMR because of testosterone. Voluntary muscle movement causes increased heat production. Well, think about that. Think about going out and going for a jog around the block. You're going to feel a little bit hot? I would say yes, you are. And shivering can increase heat production, and that's why when you get really cold, you shiver, because it helps increase your body temperature. The hypothalamus, which is kind of up here in your brain, it's basically your thermostat, and it's what controls your body temperature. Pyrogens, think of pyrogens. That is what increases the thermostat set point. Um, Decrease in body temperature, that's the vasoconstriction. Vasoconstriction, that means your vascular system is going to constrict, get smaller, and that makes you shiver. You're going to, that you will be shivering, but all of your vascular system will shrink and get smaller. That's why a lot of times when people are cold, their lips will turn blue, or they'll get kind of pale looking, because the veins and arteries and everything have shrunk, have constricted, they've gotten smaller. But then on the other hand, if you're hot and you have an increase in your body temperature, that's when you have vasodilation. Everything, your vascular system increases in size. This is why a lot of times you'll get flushed. You look very flushed, and like, some people, you can tell if they have a fever because all of a sudden their cheeks will be red. And then diaphoresis. What's diaphoresis? Diaphoresis, that's sweating. That's a medical terminology for sweating. So people become diaphoretic when they get hot. So heat loss. Different things can cause heat loss. You can, typically it is with obviously the environment. Heat loss, you have all these, you have got evaporation, radiation, conduction, convection. Evaporation is loss of heat by evaporation of water. Now think about that. When would you have water on your body that would then evaporate off and would help cool you? That could be your diaphoresis or sweating, right? And fever. Temperature higher than 100.2. So people that say, oh, my temperature was 99.2, I had a fever. That's technically not a fever. 100.2 is a fever. People, their body temperatures fluctuate, and it's really, they say 98.6 is the average body temperature. That means it's average. That means some people, they run 99 or higher. 99.2 could be their normal. Me, I'm 97. That's my normal temperature. So 100.2 is a fever. Pyrexia is fever. Pyrexia. That's when basically it says your normal mechanisms can't keep up with the heat produced by your body. The pyrogens, like bacteria, that's what increases your body temperature. And then, of course, the diaphoresis, that's your excessive sweat. I've got some videos here, but I can't really play them while I'm doing this recording, so y'all can go back and watch the videos on the regular PowerPoint that does not have my recording on it. So make sure you watch these, because these videos are actually pretty good and will really explain things. So please don't forget to do that. Apparently it does play here on this, but I'm not real sure. I'm going to skip through it. Okay, your pulse. Your pulse is, it's your heart contracting. So as your heart is contracting and you can feel the pressure against the walls of your arteries, that's what causes your pulse. Cardiac contractions, that's caused by the sinoatrial node, which is also the SA node. It's what causes your heartbeat. Each contraction of the heart pushes 60 to 70 milliliters of blood into the aorta. And it's got a lot of stuff here that I don't know if you need to know. Stroke volume affects your pulse character. It's got stroke volume by heart rate as cardiac output. For this class, you do not need to know that. Pulse. We have a lot of different pulse points where we check your pulse. One of the places that we typically check pulses is the radial artery, which you see this picture here, and that's right here below your thumb. The pulse is found by palpation, or you can do it by auscultation, listening. You feel with your two fingers. You do not use your thumb. Your thumb has a pulse of its own. So if you try to check someone's pulse with your thumb, you're only going to feel your own pulse. So you check with the two fingers. The strength of the pulse is determined by the force of the cardiac contraction. So sometimes you'll feel a really bounding pulse, which is really, really hard, and you have no problem finding it. Sometimes it's very diminished, very thready, where you have to really, really search for that pulse. That rate is affected by fever or pain or hypoxia, anxiety, exercise. So basically things that are going to like raise your heart rate are going to increase your pulse. It says the rate doesn't normally change with age, but dysrhythmias are common in the elderly. So it doesn't necessarily mean because you get old your pulse changes, but a lot of times it's due to some other medical conditions they may have. Respirations, how many times you breathe in and out. Another video here that I would like y'all to go back and watch on the other, the PowerPoint that's posted in announcements. So respirations, it's automatic. Your body breathes. You breathe when you're asleep. It's controlled by your pons in your brain. Your breathing is triggered by the levels of CO2. When it builds up, that it causes you to take a breath. And then, of course, it's the organs of respiration. So that's your nose, your pharynx, your larynx, trachea, bronchi, lungs. Oxygen and CO2, carbon dioxide, are diffused across capillaries in the lungs. So when you breathe in and get that oxygen in, it goes down, there's capillaries, and it's very, very thin. So that's where the gas exchange takes place at the bottom of your lungs in the alveoli. And the carbon dioxide is what we breathe out, and we breathe in oxygen. And that gas exchange takes place in the lungs. Blood pressure is, again, that's the pressure, the force upon the arteries, and it, of course, is produced by the heart. Your blood pressure can change depending upon the condition of your vascular system. If your vascular system, as you get older, a lot of your arteries, everything, they start to harden a little bit. So your blood pressure will be a little bit higher. Circulating blood volume. If you are dehydrated, you don't have enough, you haven't had enough to drink, your blood volume will decrease and your blood pressure will be lower. This is why if you don't drink enough and then you have low blood pressure, you'll start feeling dizzy or faint. This is part of like even people that start having like heat stroke, they start feeling lightheaded and dizzy, and it's because their blood pressure is low because their blood volume is decreased. Same thing as if somebody has drinks a lot, and then their blood pressure can be increased because the blood volume is higher. And that is why a lot of times when people are hypertensive, people that have heart conditions, they're on fluid restrictions, and also why we give diuretics to make them pee, to get rid of that extra fluid in their body. The blood pressure, you have the two numbers. You got like a 120 over 80 is normal blood pressure. The top number, 120, is your systolic pressure. And that's actually during the contraction. That's the heart squeezing. So that's going to have more pressure. So you have to think about that's a higher pressure. It's the squeezing, the contraction. That's systolic. Diastolic, I always remember, diastolic starts with a D, down starts with a D. So I always think that's the number, that's the down number is the diastolic. And that's the relaxation. That's when the in between contractions, the heart contractions, the heart is relaxing. That's why the number is lower. So like a 120 over 80 would be 120 systolic, 80 would be diastolic, and that would be the systolic is the contraction of the heart, and diastolic would be when it's relaxing. this was pretty much on the last slide, affected by cardiac output and increases with increases in blood volume. Another video. Got lots of videos in here. Okay, if the blood volume decreases, okay, so here it talks about dehydration, also hemorrhage. If you're bleeding, if you're often people that have like a trauma and they're bleeding excessively, this is what happens is their blood pressure decreases so much that they can't stay, the oxygen's not going to perfuse to their body. Vasoconstriction and vasodilation can alter blood pressure to compensate. So what that means is we have medications that we call them pressors because it's basically causes vasoconstriction. So somebody that has really low blood pressure, one, we're going to give them fluid because we're going to help try to pump up that fluid level to increase the blood pressure. But we can also give them medications, and we can give them like pressors that will help constrict the vascular system, and when it constricts it, it will cause the increase in blood pressure. On the flip side, somebody that's blood pressure is really high, we're going to give them a vasodilator, something that's going to relax that vascular system. It's going to open it up so that the blood flow can go through with less pressure, and that will help lower the blood pressure. Here this talks about aging, and it talks about temperature, that they can have a heat loss with cause hypothermia. They often have a lower metabolic rate, so they're hypothermia, so they're cold. Their respiratory rates may vary because they have decreases in vital capacity. That just talks about the amount of air that your lungs are capable of taking in and taking out. And there's the systolic and diastolic blood pressure may rise with hardening of the arteries. So normal body temperature, anywhere from 97.5 to 99.5. You should always know someone's baseline, so when you take their temperature, you know whether it's increased or if it's abnormal. So rectal temperatures, you can take, a lot of times any of you that are parents know that you, like your babies, you take the temperature rectally. That temperature is about 1 degree higher than oral. And axillary temperature, that's up when you take it in the up in the armpit. It's going to be about 1 degree lower than oral. The tympanic membrane measurement, that's when the thermometer that goes in the ear, that is it's pretty good for determining core body temperature. Let's see here. So different things can affect temperature, different times of day. Basic circadian rhythm can affect that. Environmental temperature. If you're outside and 100-degree heat here in Florida and you come inside and take your temperature, it's going to be higher because you've been out in that extremely hot weather. Age of the patient can affect it. Any physical exercise, you don't want to go jog around the block and then take your temperature because obviously it's going to be elevated. Menstrual cycle and pregnancy will affect it. Emotional stress, disease conditions, different drugs, eating, drinking, and mouth breathing all can affect it. Come on, my slide won't change. There we go. Okay, so you can have hyperthermia. Remember that's high thermia, high temperature. So temperature is above the normal range. That's called fever or febrile or pyrexia. We tend to call it febrile. That's what we call it more than anything else is if somebody is febrile, that means they have fever. Hypothermia, that means the temperature is low, and that could typically be like somebody that goes outside in very cold weather and they're stuck outside, then they could have hypothermia. So some interventions to reduce fever. If someone has fever, they're hyperthermia or febrile, you want to increase their fluids because if they're hot like that, their temperature is really high, it's going to cause them to get dehydrated much much quicker. You want to lower the room temperature. You want to increase the rate of circulating air, like you just get the air flowing, remove any excessive clothing or covers, and you want to reduce the amount of activity, maybe give them a sponge bath, or even cooling blankets, and then antipyretics. And looky here, antipyretics, that means it helps reduce temperature. It's and ASA, that's an abbreviation for aspirin, just good old aspirin, ASA, or acetaminophen, and acetaminophen is Tylenol. If somebody has a known infection, you want to check their temperature every 4 hours, or possibly every 2 to 4 hours if they have an infection that you're not real sure what is causing it. Hypothermia. It's got the nice little snowflakes here because that's when you get cold. So people at risk, infants, babies are very susceptible to that. Surgical patients in the operating room are very susceptible to hypothermia. Elderly, people in extreme cold weather, or even cold water immersion. So some of the things we can do would be obviously warmed blankets. People in surgery, a lot of times the IV fluids that they give them, they warm them. So they're warmed IV fluids. They put nice warm fluid all into their veins. That helps warm them up. Obviously protecting extremities using, gloves and socks, things like that. Here is how to take a temperature. We're going to be doing this in lab. We're going to be watching more stuff on this, but basically you place it under the tongue. Patient needs to put it under their tongue, close their mouth, and keep their lips closed. A plastic sleeve or a probe cover is put over the thermometer so that we can get rid of that and prevent spreading germs. Most of our thermometers nowadays are digital, which are wonderful because they're very quick. If you're old like me, the only thermometers we had when I was a kid were the glass ones that had the mercury in it, and you had to shake it down to get the mercury down, and then you had to hold it in your mouth, and it took forever. I think it's 3 minutes is normally what they say it takes. I haven't even seen one of those thermometers in years, but it's here in the PowerPoint somewhere. So taking a rectal temperature, provide privacy, drape the patient, reveal only the anal area, don your gloves, lubricate the tip of the thermometer, hold the thermometer in place 3 to 5 minutes, or like I said, most of these are digital now, they go off pretty quick. Then wipe the thermometer off, or usually they have the disposable. You just get rid of the disposable protector probe thing. Wipe the buttocks to remove any extra lubricant, and dispose of everything and wash your hands. So why would we take a rectal temperature? Obviously we take it on babies, infants, because you can't really have them do oral temperature. But a rectal temperature will get a core temperature. So sometimes, especially if they are exposed to cold weather, you'll need to get a core temperature. Now remember, the tympanic, the one in the ear, will also get core temperature, but a rectal, you could use that as well for core temperature. Here's the axillary temperature. It goes up under the armpit. Place the thermometer in the center of the patient's dry axilla. So sometimes if it's wet and sweaty, you may have to get something to wipe it off and dry that area. Have the patient hold their arm tightly against their chest. It says leave in place 3 to 8 minutes, but again, that would be the probably the older ones now. The digital ones pretty much so where it's pretty fast. Here's some different thermometers. This top one is the glass one. I don't know if y'all can see that, but it like I said, can't even tell you how long it's been since I've even seen one. Then of course we have the different digital ones. And then there's also you have the tympanic. You've got some that go on the temporal. You have like some that go on the forehead that are disposable. All different types of various thermometers. This talks about the glass thermometer. Yeah, I like I said, I don't even know why we even talk about this, but you do have to shake it down. There's this it has this, it rises, and so you have to kind of you shake the thermometer and shake it down. And then of course if you to read it, it's kind of hard because you have to kind of hold it and then horizontally and kind of wiggle it back and forth a little bit to see where that well, it says column of alloy. It used to be mercury. I guess it's not mercury anymore, but that's what rises. Oh, see, non-mercury. All right, electronic, does the body temperature 5 seconds to 1 minute? Yes. The other ones were saying 3 minutes to 8 minutes versus 5 seconds. I'll take an electronic one any day. The oral probe is put in a plastic cover or sheath. That's the word I was trying to think of a few minutes ago. Guys, I'm recording this pretty late at night, so that's why I'm like starting to lose my lose my thought process here. Temperature is displayed digitally. We like digitally, don't we? There's the one that we're used to in healthcare facilities, right? You've got all the little probes right there in the little box. You take out your little probe, pop it into that probe cover. That for any of you that have not used one of those before, it usually has a little box that have the probe covers. You take that metal probe, stick it in the plastic probe cover so that you can use it, take the patient's temperature, and then after you're finished taking their temperature, you push a little button and it pops that little probe cover off, and that way you can you have a different cover for every patient to prevent spreading germs. Tympanic. This is put into the auditory canal. It has a plastic cover that covers it. So again, it's has that disposable cover, so you can use it from one patient to another. Change that little plastic cover, and the temperature is displayed digitally. You've got a temporal that's placed on the skin of the forehead over the temporal artery. It's less invasive than the tympanic. And tympanic isn't terribly invasive, but it says it's more reliable if you use it correctly. You see this a lot in doctors' offices now, where they hold it. I'm sure y'all see this, where they hold it and then they kind of run it down. They run it, and it gives the temperature. Disposable thermometers, they're like little tapes. It looks like tape, and you just place it on the, like usually tape it on the forehead. See this? It just kind of sticks on and takes the temperature, and then you just throw it away. All right, Allison's taking the temperature of her patient. Which of the following was true when taking a patient's temperature? Rectal temperatures are usually 1 degree lower. Axillary temperatures are usually 1 degree higher. Glass thermometers must be left in place under the tongue for at least 3 minutes. Or a tympanic membrane is a poor indicator of core body temperature. Okay, what's the answer? Number 3, right? It's 3. Glass thermometers must be left in place for quite a while. Rectal temperatures are usually 1 degree higher. Axillary temperatures are usually 1 degree lower, so those two are they're reversed. And tympanic membrane is a good indicator of core body temperature. So all of those are incorrect. This number 3 is the correct answer. All right, Allison's patient has a fever of 103. Allison should perform all of the following interventions to reduce her fever, except. So, do we want to decrease fluids? Do we want to lower room temperature? Remove items of clothing? Or carry out any physician's orders for cooling measures? So, she needs to do all of these except number 1, right? We don't want to decrease fluid, we want to increase fluid. We want to increase fluid to prevent dehydration. All right, pulses. So pulse rate, we take a pulse by pressing on the artery lying over a bone. During illness, a pulse may be different. It may change. The characteristic of a pulse rate is rate, rhythm, and regularity of intervals, the force of the heartbeat, and the most common place to feel for the pulse is the radial artery in the wrist. So the radial artery, it's at the base of the thumb. You've got a temporal artery just in front of the ear, carotid artery on the side of your neck, a femoral artery in the groin. Your apical pulse is over the apex of the heart. The popliteal pulse is behind the knee. Those are very hard to find. I don't know if I've ever felt anyone's, popliteal pulse. The pedal pulse, looks like pedal, but it's pedal pulse of the posterior tibial artery on the inside of the ankle behind the malleolus. So again, radial is the one that we usually is the most common place. Here's the different pulse points right here. Shows all the different places where you can get pulses. That's the brachial. That's when we do blood pressure. We listen over the brachial artery right there. There's the radial, femoral, popliteal, posterior tibial, and dorsalis pedis. So average pulse is 72. Now a normal pulse rate or heart rate is 60 to 100. So the normal pulse is 60 to 100. Over 100, it's tachycardia. Tachycardia. Tachy means fast heart. Slower than 60, lower than 60, it's slow. That's Brady. Brady means slow. Brady, basically this means Brady heart rate. So between 60 and 100 is good. Over 100 is tachy. Less than 60 is Brady. Usually part of your uniform should be a watch with a second hand because we do use that for respirations and pulses. And it's very hard to do with like a smartwatch because sometimes you can set them to have where they'll have the second hand, but my smartwatch always turns off when I'm doing that. So you need an actual watch with a second hand. I know some people have those really cute ones that hang from it's like from their badge, like their badge reel, or is it their stethoscope? But I know I've seen some that like attach on their uniform some way. Things that affect pulse rate: age, your body build and size, your blood pressure, any drugs that you take, your emotions. You know that you start getting nervous, you're getting ready to take an exam. What does your pulse do? It starts racing, right? Exercise, pain. If someone's in pain, their pulse rate is going to increase. Or hypoxia. When you don't have enough oxygen in your blood, your pulse is going to increase because your body's trying to pump that blood through your body faster to get as much oxygen as possible. Somebody has blood loss, if somebody's in like a car accident or something, they're going to have a very rapid, weak pulse. Sometimes we even call it thready because it's not regular. Okay, here we go. Arrhythmia. Arrhythmia. You think about rhythm. Rhythm is normal as a regular steady beat. Arrhythmia means it's irregular. It's not a normal. It's going to have like skipped beats. So we do talk about the strength of a pulse. It could be weak and regular, which would be even beats, but we call it 1+. A strong and regular pulse would be 2+. Full and bounding. Bounding means, man, that pulse is practically jumping out of their skin. That's a 3+. We also can have a feeble, which you can barely find it, or irregular, thready. Thready means that it's just very weak. or absent means no pulse at all. That's not good. Respirations, that's how many times people take a breath in and out. You can count respirations for 30 seconds and then multiply it by 2 unless somebody has really very irregular respirations, and then you need to count it for a full minute. So different respiratory patterns. Eupnea, look at that last part of that word, PNEA, and think about things like pneumonia. That basically, this is referencing breathing. EU means normal. Eupnea, normal, relaxed breathing. Dyspnea, that's difficult breathing. Tachypnea is increased or rapid breathing, and I don't know how to say that. Bradypnea, I think is what it is, but that's very slow, shallow breathing. So just know those words again. Anything tacky is fast, Brady slow. This means difficult, and then this just means normal, and then the last part of the word is breathing. So normal, difficult, fast, slow. Different respiratory patterns. You've got hyperventilation. That's when people are really, really breathing fast, and that's where you see where they would give people like a paper bag to breathe into so that they can breathe that carbon dioxide back in. Cheyne-Stokes, that's a dyspnea followed by a short period of apnea. You'll see that a lot of times as people are into life. They'll have difficulty breathing, and then they'll stop breathing for a short time, and then they'll take a deep breath, and then they'll breathe a little bit more. Kussmaul's, that's an increased rate and depth with panting. You'll see that sometimes with like DKA, diabetic ketoacidosis. You'll learn about that later. And I don't know how to say this, I think it's Biot's or respirations, and that's shallow for 2 or 3 breaths with a period of variable apnea. Again, that sounds like a dying into life breathing pattern. So when you listen, respiratory patterns, this is when you're listening with your stethoscope to someone's lungs. There's different sounds that you can hear that are not normal. Crackles would be one, and it literally sounds like crackles in the lung. It sounds like a crackling of a bag, I guess. But you can definitely tell crackles. Rhonchi is a continuous dry sound that's usually caused by obstruction. A lot of times if there's like mucus stuck in there or something. Stertor, that's like a snoring sound when they're unable to cough up the secretions. Stridor is kind of like a crowing sound, and it's obstruction, and it's hard to describe. We'll listen to some examples of those, but it sounds like a very painful breathing. And then wheezing. Wheezing is a whistling sound. So we measure the oxygen saturation in someone's blood. We use a pulse oximeter, and it goes on the finger. I'm sure all of y'all have had this at one point or time in your life. It measures, like I said, your oxygen saturation, determines the percentage of hemoglobin that is bound with oxygen. It's attached to a person's body, typically on the finger. Now, if women have like dark fingernail polish, you have to remove the fingernail polish for it to work correctly. You can also put it on an earlobe. You can put it on the tip of a nose. You can put it on a toe. But we do see it on the finger most often. Blood pressure, I don't know why this keeps bouncing back and forth between the different, but we'll just roll with it. Average blood pressure is 120 over, this is 120 over 70. I've always heard 120 over 80, so that's interesting. I don't know why this is saying 120 over 70. Typically 120 over 80 is a normal blood pressure. Things like anxiety, fear, stress elevate the blood pressure. Also pain. Take a person's blood pressure in a quiet room, a relaxed environment. If there's a lot of things going on, a bunch of people running around, their blood pressure is probably going to be elevated. That's another video which we are not going to watch. Carotid cuff sounds. This is different sounds when you're listening. When you're taking blood pressure, you will hear different sounds through your stethoscope. These are the different sounds. That is that video that I just skipped through. I'm pretty sure talks about these and even gives examples, but we will also do that in lab. There's a video in lab that will actually play these sounds, and you'll hear them. There's a video there. Okay, so go back. Lots of videos. Go watch these videos because I don't want to play them here on my recorded thing. It actually causes problems. Okay, we're almost done. 10 more slides. Hypertension, that is high blood pressure, hyper, systolic pressure above 140 and a diastolic above 90. That is considered hypertension. Prolonged hypertension can cause permanent damage to your brain, kidneys, heart, and your retinas, your eyes. Hypotension, now that's low blood pressure, less than 90/60. Says postural hypotension. This is especially when people go from sitting to standing, and all of a sudden they just kind of black out a little bit. Sometimes they may even actually pass out. Now, if somebody that's called syncope. So syncopy is fainting, syncope, or a syncopal episode. That means that they kind of blacked out and maybe not even completely passed out, but they can black out, and that's usually from a drop in the blood pressure. Often you'll see it with people that are dehydrated. They haven't had enough water, and then they go from a sitting position to a standing. They stand up really quick, and then they just everything kind of goes black for a moment. That's this postural hypotension. So pain is the fifth vital sign. So anything with pain, you need to assess the location, intensity, character, frequency, and duration. We'll talk about that. There is a special way to assess for pain, and we'll be doing that in lab as well. Typically, we use a pain scale. We usually say, what's your pain level on a scale of 0 to 10? 0 is no pain at all, and 10 is the worst pain you've ever had in your life. And we ask the patient that. Automated vital signs. Often in the hospital, we will hook people up to a monitor, and it will take their measurements. We can set it up where it does blood pressure every so often. Like the monitor, you can set it up however you want, every 5 minutes, every 15 minutes. And usually the pulse ox, it keeps a continuous pulse ox on there, and heart rate. So it's personally, I love this. I was on a tele unit where we had the monitors. A lot of people have now the monitors, the little boxes that they put in their pocket of their gown, but I used to like the monitors that were like up kind of on the wall, so I could just walk in and just glance and see exactly what was going on. That was helped me out a lot. This is all talking about recording stuff on like a graph. I'm not even going to talk about this. So, okay, a question. We got Allison's taking her patient's pulse. Which site is most often used when taking a pulse? I said this like 3 times, so hopefully y'all know this one. What site is most often used when taking a pulse? Radial artery, right? The radial, that's on the wrist. All right, Allison's patient has a heart rate of 54 beats per minute. This is defined as what? Is it tachy, brady, an arrhythmia, or is it normal? 54 beats. It is bradycardia, anything below 60. Normal is 60 to 100. Over 100 is tachy, under 60 is brady. And last question, which is not an appropriate guideline for measuring a blood pressure? Which is not appropriate for measuring a blood pressure? Have the patient lie down or sit for 5 minutes. Use the radial artery. The arm should be supported on a surface at the level of the heart. Inflate the cuff to 30 millimeters mercury above where the pulse disappears with inflation. Or obtain systolic and diastolic readings and deflate all the way to 0. What's not appropriate? The answer is number 2. We do not use the radial artery for blood pressure. We use the brachial artery, which is on the inside of the elbow. So we use the brachial. So that is the not the appropriate guideline. Okay, that's the end of this lecture, and let me know if you have any questions. Thank you.